On this episode of Gross Anatomy, we talk about Pam Bondi getting thyroid cancer and the Huffington Post reaching out to me to discuss. We also talk about cooking and medical cooking and some of my new latest and greatest recipes. Check it out. Are we live, Lauren Taylor?
We are live, and it says live now. Do you see that?
Wow, we are live with Gross Anatomy Podcast, where we explore the sights, smells, and sounds of medicine, how it relates to movies, TV, books, pop culture, podcasts, and the world around us. And I'm Dr. Jason Cohen.
Dr. Cohen was featured in the Huffington Post very recently. Would you like to talk about that, Dr. Cohen?
Yes, very recently we were featured. Did you read the article, Lauren Taylor?
I did read the article.
Oh, nice. They reached out to us because of...
Because you're the thyroid guy.
Right, because I'm the thyroid guy. But who was just diagnosed with, actually, I don't think it was that recent, right? I'm trying to, how recent was...
So I don't know exactly when she was diagnosed, but the former Attorney General, Pam Bondi, was diagnosed with thyroid cancer, and she's undergoing treatment and had, I guess, a surgery a few weeks ago. So I don't know when she was.
So it was recent. I didn't realize how recent it was. I am not obviously her treating doctor, but so they reached out to me because I am the thyroid guy, just asking some general things about thyroid cancer and all of that, and that was kind of cool. It was kind of fun.
Yeah. So can you give our audience, like that didn't get to read the article, can you tell them what they should look for? Isn't that they were asking you like how you should know, like how she should have known that she had something?
And you know, the thing about thyroid cancer, the interesting thing, the good thing, the bad thing is that usually there aren't necessarily symptoms related to thyroid cancer. The good thing, though, is about 90 to 95% of thyroid cancers are pretty non-aggressive, pretty benign in the scheme of cancers, and pretty treatable. That's really the good thing. The bad thing is there's really no great way to kind of screen for it other than potentially doing ultrasounds. But what we see when we do thyroid ultrasounds, we often see nodules. And just because someone has a nodule or a lump or a bump doesn't mean it's cancer. You know, there's certain characteristics of it based on the appearance that might make it suspicious. But, you know, having a nodule is like having a beauty mark or a birthmark. But that potentially is one way to screen for it. The other thing, the main thing is to just, you know, if something's going on, if you're worried, if you're concerned, like I always say, when in doubt, check it out. That's pretty much the main thing. The other way thyroid cancer sometimes could present is a lump or a bump in the neck, either in the middle of the neck or even on the sides of the neck with a lymph node. Oftentimes, one of the ways thyroid cancer is detected is a patient may have some kind of scan for something else. You know, they're having neck pain or they're having their chest looked at and get a CAT scan or an MRI of the neck or the chest, and it shows an incidental nodule in the thyroid that then gets worked up. But the good thing, the fortunate thing is about 90 to 95% of thyroid cancers are pretty treatable and curable. And so that's definitely the benefit.
So we get into news that's good and bad. I have some more bad news. I've never heard of him before because I'm not a big NASCAR fan, but I thought this was very interesting and that's something that people should know about. But it was big news because Kyle Busch is apparently a very famous NASCAR driver. Did you read this story? He was 41 years old and he died of pneumonia that progressed to sepsis.
I didn't read about it. I heard it on when I drive to work. Unfortunately, I live deep in the valley, and so my drive is usually long and tedious. Getting to work to the hospital, it's often about an hour, give or take. So I get to listen to news. So I heard all about it on the news. And he was a young guy, right? He was in his 40s.
Yeah, he was 41. And what's interesting is, so they didn't know exactly why he died before, but they have recording of him calling someone when he's driving to say, you know, asking for a shot from NASCAR physician Bill Heisel during his race on May 10th. And then it says Heisel met Busch at his motorhome post race to administer care. And then the next week at Dover Motor Speedway, Busch was asked about his condition. And he said, "I'm still not great," he told reporters on May 16th, but the cough was pretty substantial last week. Then on May 20th, someone called 911 from GM Technical Center. So he's still racing this whole time.
Yeah.
And mentioned that Busch was short of breath and coughing up blood during the testing session he was undergoing at the simulator. He died the following day.
Wow.
So he was treated. Bill Heisel is a PA-C, which is a physician's assistant certified. I don't know if that's any different than just a regular physician's assistant. Is that what they all are now?
Yeah, I think so. I think if they take their exam, they get the C, I guess, their board exam or something.
So, I mean, my question is, I mean, I get like PAs can write scripts and stuff, but as a PA, should he have been told to go see a doctor? If you're giving him a shot, what do you think the shot is? Just some like
I mean, it could have been an antibiotic. It could have been an antibiotic. It could have been steroids. Who knows? Yeah, and all the PA didn't tell him to go to the doctor. He just gave him a shot.
I don't know that
Or
he's
the
done an
hospital?
interview. I couldn't find information on that. So maybe he did tell him, and maybe he just wanted to keep racing because that's his job. He gets paid a lot for it.
Yeah.
I mean, that probably is part of what he says after he gives a shot. Like maybe you should go see a doctor. I don't know, but I just I read another doctor was asked by some reporter, like, what do you think about this? And he was like, I think athletes need to learn that they're not superhumans. People die of pneumonia. Like, you have to go see a doctor.
Yeah.
So, I mean,
For sure.
think the coughing and everything, like, I think people, even my husband was like, because I was like, it was probably pneumonia that he died of, and he didn't think so. And I was like, no, people die. I mean, you can be 41, young, healthy, and it can lead to sepsis.
Yeah. And I think a few things about that. I think all too often, like you said, he's not Superman. So I think, we need to realize, if something's going on, don't ignore it. I think that's super important. But I think the other thing, which is, we see it, we as caregivers and even individuals, we treat celebrities and athletes. Sometimes we try to treat them, giving them extra special care, whereas it's not that we're actually giving them extra care. We're actually, by trying to go around and do things maybe in shortcuts and bypass the system a little bit, and giving them, we try to respect them, and maybe we make mistakes in that we forget to treat them as regular people with regular illnesses, that if they're having blood out their butt, they need a rectal exam, or if they're having a cough, they need to go, it's not just a shot, or it's not just, oh, you're going to be okay. Let's find it's, if something's going on, we got to, treat you like we would treat anybody, and make sure we get you checked out and taken care of. And I think, we as individuals, unfortunately, mistreat sometimes, celebs or athletes and things like that, because we're trying to accommodate them.
Right. Or, I mean, another word is you're trying to please them. You want to make them happy. And I get all that, but I just think if he had symptoms going on this long, and you imagine he does have like a doctor on call, but who knows? I don't know the ins and outs of it. It's sad anyway you look at it, but he was also, so in that simulator, they simulate like G-force, which I imagine that's when he started coughing up blood and stuff, like during the test simulator, which if you even have like a cold can be just like super painful. And I don't know if that had anything to, I mean, I guess if he went into sepsis, that didn't have anything to do with why he died, but I don't know. Certainly
Right. That I don't know. I don't know how much that played into it. Hard to say. Yeah.
It says, I guess if you have a cold or sinus infection, that the G-force can lead to dangerous medical condition called barosinitis or sinus squeeze. The rapid pressure changes during tight turns or elevation shifts. So I guess it's like a sharp pain that can cause fragile blood vessels in the upper respiratory tract to rupture. So I don't know if that had anything to do with it or not.
Who knows? But it sounds like it was brewing. It sounds like it was brewing for a little bit, and unfortunately,
Yeah, but I wanted you to tell the audience too. Your mother-in-law, you were afraid she was about to get sepsis. Remember, didn't she go to urgent care? She did go checked out by a doctor, and they missed it.
Yeah, she actually did get septic. She was septic, and I don't know if we talked about it. She had a crazy gallbladder attack that led to sepsis, so much so that she had driven herself to her doctor, where she saw a nurse practitioner at her doctor's office, and then drove herself back and doesn't remember. It turned out while she was driving back, she hit a car. Her car got totaled. The cops pulled her over. She had no recollection of any of that. And that's what sepsis did to her. She had no clue of anything.
So was she like close to organ failure, like going into shock? Like if you guys didn't get her to the hospital when you did?
Who knows? Who knows? Luckily, we got her taken care of, and we got her to the hospital, and we got her operated on, and thank God she's better. But yeah, it's pretty remarkable how the body could start slowly shutting down.
Yeah, that's interesting. Okay. Well, that is the sad story about Kyle Busch. It also said that people at risk of sepsis are people that have catheters. Like I read that. Why is that?
So that's a great question. So a catheter is basically some kind of tube put inside of you. So an intravenous, an IV is a catheter. It's a tube that goes in, a catheter going into your vein. Then there's a catheter that goes into your bladder, for urine and stuff like that. So basically, it's a foreign body that's in the outside world that's now going inside of you. And we have bacteria living in and around us, on our skin, in the air, all over the place. So this catheter is inserted inside of you. And we have normal skin bacteria and normal bacteria in our genital area and all that stuff. So if for some reason there's bacteria from us on that catheter, whether it's an intravenous catheter or a urinary catheter, or any kind of catheter, it's a way for bacteria to get introduced into us. So, and then that could lead to infection, which could then lead to sepsis. So, certain protocols are don't leave a catheter in for too long. There are protocols to actually change out the catheter every few days, potentially, if it needs to be in there, whether it's an IV or a urine catheter, or any kind of other kind of catheter that's coming through us. Often there's a protocol at most hospitals to change them after 2 to 4 days, kind of just depending.
Okay. And then are patients that have one supposed to look out for something after they leave the hospital? Like, is there a risk? No,
not necessarily. Okay. Yeah, there's nothing specifically to look out for. I mean, certainly if something's weird or wacky or you're not feeling good, you call your doc. And there's no question that's dumb. The only downside is you may spend your day, or hours getting it checked out. But at the end of the day, that's not wasted time, especially if there's something serious. So it's always worth getting it checked.
Absolutely. I agree with you. In better news, culinary medicine class is now in session. Did you see that? I've sent you something.
All right. Yeah, what is that?
Tufts University School of Medicine offers a 2-month culinary medicine class to train doctors, dentists, and dietitians. So now, I guess, as a class, as part of your medical school training, you can take a culinary class, which I thought was pretty cool.
So what is it? It's actually teaching people how to cook, or it's teaching them the nutritional value of food? I didn't deep dive in that. What is that exactly? And is the purpose so that we as caregivers know how to feed ourselves, or is it?
Yeah, I think it's too a way to talk to patients about, like, if you have a patient with diabetes, and like how could you tell them what to prepare a meal, and like if you actually know how to do it, and like you can give them simple recipes, or you can actually write them basically a script for a meal, like you can understand how to do it. So the first Tulane University established the first teaching kitchen in 2012 and formalized a style of evidence-based curriculum that embraces a simple tenet: food is an essential part of healthcare. So I guess I mean, I don't know exactly what you learned because I've never taken it, but now more than 60 medical schools, residency programs, and nursing schools use a version of this curriculum. So I guess it's becoming popular. So the
Yeah,
practice of
I'm
treating
curious.
disease.
Is it just like a fun class for the students to take, or is it like
I think
serious?
I think it is fun, but I think it's the practice of treating disease. Like, how can you treat patients with severe disease with nutrients, with food? So I'm sure they're learning like specific recipes to make for different things. Or
Interesting.
yeah,
Yeah, I need to see that. But what intrigues me though is a lot of what we do in medicine. Um, a lot of it is evidence based, but a lot of it is also just fad a little bit,
mm,
and kind of general population brainwashing, the whole food pyramid thing and all of that. And whether there's real evidence behind any of that or just consensus or, we talk about, most of the world says we need to eat meat,
yeah.
certain, get our protein from meat and chicken and eggs. And I don't know if I don't necessarily think that's a truth. So it's interesting. I'm curious to see how that's really structured.
I imagine it's like stuff that is more evidence based, like people with that are diabetic can't eat, they can't have certain things. So it's like, how would you make
A low
yeah,
carb diet
yeah,
or something.
exactly.
Yeah.
Something that's maybe more proven, but I'm not sure. I mean, I'm not in this class. I just thought it sounded fun, but
Yeah.
I
But
don't know.
also, we as students and certainly caregivers going through the whole medical education process often don't care for ourselves. So I wonder how much of it is also to have the caregivers learn how to care for themselves and take care of themselves. When I was a big carnivore back in the day before I moved out to LA and became the weird LA guy. But um, and I had gone on the Atkins diet. All these diets are fat, and that was like a high protein, nothing else diet. So I was, even though I was thin and kind of healthy because I was young, I was just basically eating hot dogs and Diet Coke, like a ton of hot dogs and Diet
Yeah.
Coke. And that's probably not a good thing.
Yeah, I mean, that's a good point. I would imagine they stay away from those type of fad diets because they do come and go, and it's crazy when if you listed them all. There's so many, like we're not even thinking of, I'm sure. But
Yeah.
Atkins is a weird one to think of now. Yeah.
Yeah. And there was a zone diet too, which was even more interesting.
Uh,
But the reason why there's so many diets is because there isn't really one perfect one, and I think it's kind of a combination of things that we need to think about. And it's interesting. I had a patient today a patient of mine who texted me saying, "Could you recommend me to have weight loss surgery? A gastric sleeve?" And I said to them, "Why? Today there are these medicines, the GLPs." And the patient said, "Well, I've been on and off of them, and when I go off of them, I gain weight." And I think of this one guy who I'm kind of friends with who had gastric surgery years ago to lose weight, and for years he was skinny. But then over time, you could start eating again, and your stomach kind of adjusts, and the guy's a big guy again now. So, um, I think all of these things are great jump starts, and I certainly prefer the medicines over a surgery. Um, but you can't just rely on that. It's got to be a whole lifestyle change, and
right.
and it's hard. And I think going on and off of these medicines, personally, I think is better than having a surgery. But I guess
Yeah.
time will tell.
Well, that's probably the point of this class too, to learn that, it's the whole package. So they're learning about the food part. But like you said, that's a really good point. Maybe it is about just the doctors taking better care of themselves, learning these simple things in the kitchen. So,
Yeah, yeah.
so would you take that class if you were in med school now?
Yeah, definitely. A, because it's probably fun. B, I'm curious. Actually, I think I should be one of the instructors, to tell you the truth, in the class. But yeah, no, it sounds like it's a fun class. Why not take a fun class?
All right. Well, their final project, they have to do a recipe for an imaginary patient. Can you think of who your patient would be? I'm putting you on the spot. Like, would
Uh,
you have someone you'd want to cook for, a patient you just want to get on the right track?
oh, like,
It can be but we'll make it imaginary. We won't give a name.
well, I'm the weird plant-based guy, and a lot of people are like, "How do you get your protein from plant-based stuff?" So, for me, I don't even really need an imaginary patient. I think it would just be, some good, fun plant-based food,
Mhm.
um, that I would do.
Okay, cool. I don't know
Make
what I would do.
I've discovered there's have you ever had Potato leek soup?
I don't eat a lot of soup, but sounds good.
Uh, well, I discovered and kind of amended a not potato leek soup. I call it not potato because it's more about the leeks in like this thick potato broth, but it's really more about the leeks that kind of melt and are creamy, and it's just really delicious.
Nice. I didn't
Yeah,
know. So have you been cooking more?
I've been
Oh,
so we do Friday night Shabbats every Friday night,
okay.
and guess who the main chef is?
Well, I knew you cooked, but I didn't know like how much, I guess.
Almost every Friday night I'm
Okay.
cooking.
Impressive.
Yeah, for the last, 20 years or so.
So what's the favorite dish that you make? Like if you could make the audience anything, what would it be?
Well, there's something called chulent, which is a Jewish dish, which is kind of like chili. It's almost like chili, but it's not necessarily so spicy. It's beans. It's made with meat and beef and bones and potatoes and barley and beans and veggies. But I make a vegan vegetarian version of it with Brussels sprouts instead and mushrooms that kind of give it a meaty flavor. And the interesting thing about it is, um, and the reason it came around is the people would make it. You're not allowed to cook on the Sabbath, right? So they would throw everything into this big pot and all those ingredients into a huge pot, and then put it in the oven. You put it in on Friday, and it would be ready on Saturday for lunch. And so that's the key, to have it cook in like a crock pot or something like that. At least 24 hours, and it just all becomes the, and I use a ton of garlic, and it's just so good.
I've been going to the farmer's market and getting fresh garlic. I never knew garlic had like green whole like stems that you can also cook with. I was like, oh, what is this?
Yeah,
Learning things too. But your
yeah,
dish sounds delicious, and I love that I could eat it because I'm a vegetarian. So amazing.
right, right. But our one of the later dishes, it's a cooking episode that we do, is, I forget which kind of mushrooms. It's I think trumpet mushrooms. Have you seen trumpet mushrooms?
I don't think
They're
so.
they're like these big fat things with then like a top hat on the top, and it kind of looks like something out of Alice in Wonderland.
Ooh, I love
And
mushrooms. No, I don't know that.
yeah, I'm a big mushroom guy, and you slice them to kind of look like scallops,
Okay.
and then you cross hatch both sides of them, and you cook them. I cook them with vegan butter, which probably isn't that healthy, a vegan butter. It's so processed. And then I add different sauces to it, and everybody says it tastes like scallops. It's kind of like one of the current favorites, and I don't know scallops. I've never eaten it, but it's a current fan favorite. Is the scallop mushrooms?
Well, that's something else we have in common. I've never tried a scallop either. I was trying to like picture. I'm like, wonder what that tastes like. Really?
Try these trumpet mushrooms.
Okay. I'll see if there's a mushroom lady at the farmer's market. I didn't see any of those in her booth, but I'll ask.
Yeah, they're good. They're really
Nice.
good.
All right. Do you want to move on to entertainment?
I
Are you,
do want to move on. Let's move on.
um, I was looking up, so it's June, and the June summer movies are kind of a nothing. Oh, there's one, June 12th, Disclosure Day, directed by Steven Spielberg, starring Emily Blunt and Colin Firth. Could be cool. It's like
I didn't even see that one. I have no idea what that is.
Alien, Spielberg. I'm like, it's got a good
Uh,
track record, so who knows?
yeah, great cast. Um, I saw a trailer for a Paul Rudd, Harry Styles movie. It looks maybe interesting.
You
I
stumped
like
me. I
Paul
haven't seen
Rudd.
it. Yeah, I do too.
I think it's coming out like this week or next week. It's about, I think it's called Ballad or something, or it's about Paul Rudd's a songwriter, and then Harry Styles is a rock star, and they collaborate and then get into it and stuff. So it looks interesting. Kind of a little, probably a little cheesy, but I'm a Paul Rudd fan. People used to say I look like him a little, so you know.
Okay. Yeah, I have not seen the trailer for that, so I'll look that up. There were just yeah, the list was like big movies, like Scary Movie, the Wayans brothers return to the franchise, Masters of the Universe, The Death of Robin Hood, starring Hugh Jackman, which I haven't watched the trailer for, and then Supergirl. Those are like the big June movies.
Yeah, I mean Supergirl. I'll see. There's nothing really these days that just grabs me like it used. I don't know if it's that I'm just more picky or I don't know. But I heard, and I doubt it's going to be good. I can't believe I can't imagine it's going to be good. That they're doing a Godfather 4. Did you hear that or see that?
How did I not? How did that not come up in my newsfeed? That's
How
crazy.
did you not see that? And the lead character is Talia Shire, Al Pacino's sister, right? Right? Is that his sister in it?
I thought, is she? Oh, okay, yeah. That's his sister in The Godfather. Yes,
Yeah.
and that
Yeah.
is
Yeah, it's the
Francis Ford
Godfather's sister.
Coppola's actual sister.
Right, right.
Yeah,
Sister?
yeah.
Yeah. And so I think she's the lead and it's based around her character, Connie.
I,
Yeah. So I don't know. I can't imagine it being great, but who knows? I'm sure it can't be worse than Godfather 3.
well, I did watch his edited version, and it is better, The Godfather 3, but it is still by far the worst one.
Yeah.
So Godfather 4, I mean, if it comes out, I'll watch it. What else you got, Dr. Cohen?
Um in terms of entertainment, it's funny. My everybody seems to be watching this hockey TV show that's not really about hockey. My sister's been, posting about it and talking about it, and my kids are even watching it. But I watched the trailer to it, and it's really not so hockey-ish, and it's like super cheesy. It's like the summer I turned pretty on steroids a little bit with
You really
guys
want to see
shirts off,
hockey?
and it just happens to be a drop centered around hockey guys, but it's really not. So
I
I
couldn't
don't know.
really.
Like,
I haven't seen it, but I had a feeling it wasn't for like people that were really into hockey.
yeah, I watched the trailer, and Bernice, the master injector, shout out to you, was kind of standing over me while I was watching the trailer, and she's like, "What kind of high school girl thing are you watching?" And she just called me out on my patheticness. Yeah, yeah.
No, I know what you're talking about. I have not watched it, but Travis said everyone at his office was all talking about these hockey shows. So I think a lot of females are watching it.
A lot of females are watching it and enjoying it. It's kind of like Highlander. Is it Highlander? Yeah. What's that show? Yeah, whatever it is. Outlander, like Outlander.
Oh, yes. I couldn't do that show, but
Yeah,
yes.
we watched a little bit of it, but enough was enough at some point.
Yeah, I'm with you on that one.
The other crazy thing that's been happening that we didn't talk about, and I got to remind me to forward it to you, is I've been hacked out the wazoo.
Oh
My
no.
identity, my identity has been super stolen. Did we talk about this at all?
No, I mean, I know people were making you say things that you didn't say and like advertise for like different things. Like,
There, there's this account now that's really doing well that one of my daughter's friends saw like me. It looks like me. It kind of sounds like me talking about health medical things. And there's tons of views. There's like tons of followers, tons of views,
that's so
but it
nice.
isn't me. And then there's one with me speaking, I think French. Uh, uh, like I gotta forward it to you. It is crazy. And then there's one talking about like gynecological health things, like
What?
a lot of stuff about women's health and like vaginal health. And it's really interesting, crazy how much my identity has been. And that's only one thing. There are plenty of other ones too. There's the bone broth one. Did we ever talk about that?
I think that is the one that we talked about. I
Right.
mean, like something you would never promote. So are they just taking your actual words from like podcasts and like your social media and just making you say all these putting it in
No, somehow I don't know how AI is, but somehow they're able to kind of use my voice the way I speak and have it say other stuff. I don't know. I'm going to forward it. Remind me to forward it to you. It's
yeah,
crazy.
that really pisses me off.
On the one hand, it pisses me off and upsets me. On the other hand, it's kind of flattering.
I mean, you're a nicer person than me. I mean, it's upsetting me just now thinking about it.
Yeah.
Yeah, I mean, the thing is, like, you can't trust anything, right? I read an article today and I was like, that seems weird. And then I read the comments and they were like, this is clearly fake. And I was like, oh man, I was reading a fake article. I didn't even know it.
Wow. Yeah. Interesting. That's one thing I tell all my students is, because it's crazy that students today I mean, everybody, we get our news from social media. So what I tell everybody is don't just look at one side. Look at,
Mhm.
no matter what news or whatever it is, look at all the sides, try to look at 2 to 3 totally different sides to that story and then come up with your view. Don't just trust one view.
Yeah, absolutely.
Yeah.
That's what I try to do. Or
Good.
nowadays, I read the comments just to see if like AI is getting me. I'm like, is
Yeah,
this real?
exactly. Exactly.
All right, Dr. Cohen, that's all I got.
That's all we got, Lauren Taylor.
Send me your French video.
I will send you the French video. All right. Well, everybody, thanks for joining us on our cooking episode, medical cooking episode, and all of my deep fakes. We hope you enjoyed it. Tune in, give us questions, comments, thoughts. Stop stealing my identity, or at least pay me for it. How about that?
Ooh.
And there you go.
That's it for this week. Thanks for listening to Gross Anatomy, and be sure to subscribe to our podcast so you can check out more episodes on the evolving sights, smells, and sounds of medicine. Gross Anatomy is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.